Hello everyone. Now I'll discuss question of neurology. So we have a 32-year-old construction worker. He's brought to the emergency after his coworker found him confused, disoriented, and bleeding from the nose. Well, he had been in the normal state this morning when he came to the worker. He then spent the morning moving heavy package hours under direct sunlight for several. Okay. Presently, his BP is 130/90. Tachycardia, temperature is, very high temperature, the keyword so far. Second was he was a construction worker and direct sunlight for several hours. Okay. Skin is warm, dry, and neck is supple with the no stiffness. That means meningitis is not there. Pupil are symmetric, mid-size. That means there is nothing to do with the pupil. Deep renal reflex are symmetric, Babinski normal. All extremities are moving, but he is not able to speak or follow his simple command. That means the main problem is very high body temperature and confusion state. Otherwise, by and large, CNS examination is normal. Active bleeding is there from the right nostril. What's the diagnosis? So keywords are construction worker, direct sunlight, very high temperature, and nose bleeding and confusion are the few keywords that we have noticed so far. Well, the answer is heat stroke. Well, we defined the core temperature is more than 40 degrees centigrade, more than 104 hour is much more than this. And altered mental sensorium. This is one reason why this fits into our diagnosis, but before I proceed further, let me tell you, there are many other conditions which can lead to very high grade temperature and altered sensorium. So, number one, it could be septicemia. It could be pontine hemorrhage, bleeding in pons, cerebral malaria, meningitis, encephalitis. These are some of the other causes of very high grade temperature and altered sensorium. Well, in every case, we have certain history and diagnostic tool, and of course, no need to say heat stroke also, which is the diagnosis in our case. But what is the single most important clue to this? That is direct sunlight working in a very humid environment or very heat environment, right? So that is a very important point, clue to heat stroke in our case also. So we have a man who developed exertion after direct sunlight, hyperthermia, acute confusion, tachycardia, epistaxis. So this fits into our diagnosis of heat stroke. So these are suggestive of exertional heat stroke. Why the term exertional heat stroke has come? This term has come here also. It means there is something called non-exertion also. Yes, there is something called non-exertion. Non-exertional heat stroke typically affect individual with extreme of age. Well, an elderly man sitting in the sunlight and not able to obtain adequate fluid, removing themselves from hot environment. And these are the people who suffer non-exertional type of heat stroke. Well, exertional heat stroke that we get question about exertional heat stroke. Most commonly who are exposed to hot, humid environment with inadequate access to shade and fluid. Who are the people? Factory workers. better is construction workers who are exposed to sunlight, military recruit and athlete. They are the people who are exposed to direct sunlight. Extreme ambient heat and humidity they can impair sweat production. And we know very well sweat normally serves as the body mechanism of heat dissipation. Sweating comes, it takes away heat, but that is hampered. Now, what are the complications of heat stroke that can happen? Rhabdomyolysis, renal failure, ARDS, coagulopathic bleeding, and this bleeding explains the patient persistent epistaxis. Now let's look into other option. I mentioned that viral encephalitis or any encephalitis can lead to high-grade temperature with altered sensorium. But these patients develop symptoms rather quickly. It occurs only in hours. This is occur but never happen so fast. And moreover, in these temperature is never goes that high what we have in this patient. Okay, so unlikely. Malignant hyperthermia affect genetically susceptible individual during anesthesia. There are few patients to whom you give some drug. They can lead to very high temperature, what we call as malignant hyperthermia. Now again, I have a question for you. Stop the video, write down the answer. Which drug in anesthesia can lead to malignant hypertension? Well, the answer is halothane, succinylcholine. Okay, so if the question to ask to you that soon after surgery or anesthesia, patient develop high grade temperature, then you think about malignant hyperthermia due to drug induced. Hypothalamic stroke. It disrupts normal neurogenic regulatory system and result in neurogenic fever. Well, in young patient is unlikely to have our patient is a young man, 32 years, and moreover clear-cut history is there. Clear-cut history is there, and that cannot of a heat stroke, exposure to direct sunlight, young age, no predisposing factor for CVA is very, very unlikely. Thyroid storm occurs in those patients with grave disease due to increased circulating catecholamines. They lead to have tachycardia, hyperthermia, arrhythmias can occur, especially atrial arrhythmias are very common. But these type of patient doesn't have any feature of grave disease. Okay, so this is very unlikely diagnosis. Golden line to remember: acute confusion, extreme hyperthermia, tachycardia, coagulopathic bleeding after heavy work under direct sunlight are the most likely due to exertional heat stroke. Thank you very much.